If you have Crohn's disease or ulcerative colitis and want to start a family, then you may have a few questions like if you are able to get pregnant because of your IBD, or if your IBD has impacted your fertility. And this just doesn't apply to women but to men as well. So by the end of this video, I'll explain to you how IBD can impact pregnancy and fertility. Welcome back to my channel, the only place for Crohn's and colitis tips, tricks and information. So make sure you subscribe to my channel and hit the bell to be notified every time I post a video. And if you want to join an exclusive community of people who receive tips and tricks on living with Crohn's and colitis, make sure you sign up to my newsletter by visiting the link in the description box below. Now, the topic of pregnancy and fertility really interests and excites me, as I've done a master's in reproductive medicine and worked in the fertility and pregnancy field for a few years before becoming a radiographer. But let's not waste any time on that and get straight into things. If you have either Crohn's or colitis, the current research out there suggests that it does not have an impact on your fertility or your ability to procreate. The only area of concern is when it comes to medications and surgery that you've had for your IBD. If you are taking medication, as some medications like methotrexate should not be taken if you are trying to have a baby, as it can cause birth defects, affect sperm formation, and increase the risk of miscarriages. Other medications like aminosalicylates can affect sperm count and motility, so make sure you speak to your doctor if you have any concerns on the medications that you're taking if you are planning to start a family. In women who have had surgery around their pelvic area and had complications which affected their fallopian tubes can have fertility issues. Now, there's a surgery called IPAA, which is known as ileal pouch anastomosis surgery, or to put it simply, surgery which involves the creation of a stoma can also possibly affect fertility in both men and women, causing issues with the fallopian tubes and other issues like erectile dysfunction and ejaculation problems in men. Again, it is important to discuss these issues with your doctor if planning on having these surgeries and wanting to start a family. If you want to know more about what stomas are, then make sure you watch this video and I'll put the link to that in the description box below. But it's always a good idea for women who want to have children to try and have their IBD under control before getting pregnant, because this just increases the chance of having less complications during pregnancy and also allows you to remain healthy during that pregnancy. In general, most women with IBD who do get pregnant end up having a normal pregnancy and a healthy baby. There is some research to suggest that there is a risk of preterm birth and babies with low birth weights being linked with Crohn's and colitis. But again, it's important to discuss any of these concerns with your doctor and to make sure you have regular antenatal appointments to check on your well-being and your baby's well-being. So that's a very brief summary on if you can get pregnant if you have IBD. So make sure you check out these videos for more useful tips, tricks and information for Crohn's and colitis. Hit that subscribe button and the bell to be notified every time I post a video, as well as leaving a like and a comment if you enjoyed this and found it useful. And I can't wait to see you all in the next episode.